This is Jeremy with Chiro Clarity, and in this video, we're going to be talking about the atlas. This is our atlas, also known as our C1 vertebra, and it has various different bony anatomical features. To start, we have the anterior arch. Just as we have one on the anterior side, we're going to have a posterior arch as well. Now, right around midline of each respective arch, there are tubercles. This is the anterior tubercle right around midline of the anterior arch, and this is the posterior tubercle right around midline of the posterior arch. Another important feature of the posterior arch on either side is the presence of a groove. This groove is for the vertebral artery. It's demarcated by this letter D, or you can also see it with this orange coloration. On the posterior aspect of the anterior arch, we have a facet. This is the articular facet of the dens. And just as we have a facet here, we have facets here as well. These are the superior articular facets, and these are the inferior articular facets. They're shaped off what they articulate with. If you take note, the superior are not as round as the inferior. That's because the superior articular facets of atlas articulate with these occipital condyles. These occipital condyles have the same shape as the superior articular facets of atlas, except these facets are concave while the condyles are convex. In between the superior and inferior articular facets, we have what's known as a lateral mass. This is a lateral mass. Moving on either side of the vertebra, we have a transverse process. Next to each transverse process, we have transverse foramen. Just as we have transverse foramen on either side, we have a vertebral foramen in the middle. And that concludes atlas.